Yale. Neuroscientist is calling this the summer of TMS as researchers investigate how transcranial magnetic stimulation might effectively treat conditions ranging from addiction to the autism spectrum.
Yeah, how interesting. Plus, how could TMS help with anger management? Joining us this morning, Dr. Yvonne Steele, Assistant Professor of Psychiatry at Yale School of Medicine. Doctor, first of all, thank you so much for your time today.
Good morning. Happy to be here.
Good morning.
Good morning.
Such an interesting topic here. Can you talk to us about transcranial magnetic stimulation and how this may help with people struggling with alcohol or opioids?
Sure. Transcranial magnetic stimulation, or TMS, is a form of non-invasive brain stimulation where we use electromagnetic pulses that generates an electric current. All the cells in your body communicate with electric impulses. So when we put this near the brain, we can stimulate the brain and either turn things up or turn things down. And we target different networks in the brain that are related to different behaviors. So in addiction, there are two behaviors that I'm targeting. One is this craving or drive to use, and one is executive control or ability to stop. So think of this as the gas pedal and the brake in your car. When they're not balanced, then we're sort of out of control. And that's what we have with addictions. So in the Summer of TMS project that I'm doing with Hartford Healthcare, Rushford, and Middletown, I'm targeting different brain regions and different types of TMS to try to decrease craving and increase the brake in people in treatment already for alcohol use and opiate use disorders.
Doctor, I think this is a very interesting piece right here. You've also been awarded a federal grant to investigate how TMS can help people on the autism spectrum with social clues. What's the goal right there when we talk about that?
Yeah, this is a NIMH, or National Institute of Mental Health, federal grant that in collaboration with Dr. Mahal Asaf here at the Olin Neuropsychiatry Research Center, where we use functional magnetic resonance imaging, fMRI, where we take pictures of people's brains to better understand the social cue network in the brain and try to modulate that with TMS. And we're doing this in people with autism because that system is somewhat dysregulated in autism spectrum disorder, to better understand if TMS could be scaled up as an intervention to help with adults with autism.
Wow. And you're also looking at TMS and how it could be used to reduce irritability and frustration. That's very interesting. Can you talk to us about that and maybe perhaps the wider implications?
Sure. Yeah, I think these studies sort of show the different ways that research is funded. We're funded by the national government, NIH, internal grants like this one from the Center for Brain and Mind Health at Yale, and then philanthropy cover grants. And this is one where I'm collaborating with Dr. Wanling Tsang at the Child Study Center, where we take pictures of the brain again with fMRI, targeting the frustration network with TMS. Preliminary data suggests that we're able to modulate this circuit, which is very promising because frustration is transdiagnostic and that it crosses across many different clinical samples. So it's huge implications for treatment of people with clinical disorders across the board.
All right, Dr. Steele, we appreciate your time this morning. Very interesting.
Yeah, thanks for having me.
Thank you.